Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today is Dr. Huxford from OCH Huxford Clinic Pulmonary Sleep Medicine. How are you, my friend?
Very good, Troy. It's always a pleasure to visit with you.
Likewise. Well, guess what? We want to talk a lot. Last time we spoke, the vaccination hadn't been put into place just yet,
Right.
but it is now in place. Let's talk about the COVID vaccination update. Where are we in the state of Mississippi?
Well, I can speak to my community, and I know that you can have two places that you can get the vaccine now. One is at the hospital here in Starkville, and the other is at the Mississippi Horse Park. That one's being put on by the Mississippi Health Department. So there's two locations. The rules are still the same, but it doesn't matter where you go to get it. You can get it at either place.
Okay, well, that's interesting. But how have you and your doctors and your patients responded to the vaccine? I'm really interested to hear that.
I would say, as a general rule, everyone has tolerated it quite well. You hear the stories. I have friends who, probably the most common symptom I heard was just a sore arm.
Yes.
Where you got the shot. A few people had, virus-like symptoms. I only know of one or two that felt sick from it. It's been tolerated very well.
Okay, well, because there is conversation that there are side effects and things like that, but we haven't had anything reported. So I think that's just people putting that out as a bit of a scare factor, which leads into my next question. Why is it so important that people really listen to people like you and other doctors around the country and get the vaccination?
Well, one thing, the vaccine, it's confusing to know what it's actually doing for us. What we think it's doing is preventing people from getting really sick and dying. That's the main focus. There's still some concern whether or not it actually keeps you from getting the virus, and if you do, from transmitting it to someone else. But the benefit is to prevent bad sickness, hospitalizations, and death.
Interesting. Now, is it still true that I read just recently that one should still wear a mask even after being vaccinated?
That is the current recommendations. And it whether or not you've received the vaccine or not, you're still supposed to perform the social distancing. You're still supposed to wear the mask. Those rules may lighten up later, but right now it's still business as usual on that front.
Well, this is really interesting. Can you explain the process of not only getting vaccinated, but how you make the appointments?
Yes, you should. There's a phone number at OCH that's readily available on the internet and social media, and the same with the Mississippi Health Department through the horse park where they're getting it. And it's based on age. And right after the first round was for healthcare professionals, and now it's gone into the general public. But most of those are for 75 years and older right now. So if you fall in that category, call the number and they'll make you an appointment.
Well, there has also been conversation about people not being able to get through, people not being able to book online. It's taking days to be able to get that.
Yes.
Are you seeing any of those issues with?
A lot of people calling. Yeah, a lot of people calling. So, lots of messages. There's, a lot of people don't know, but the vials, or at least the ones that we have, because there's a couple different companies, they come with 10 shots or 10 doses in one vial. So they want to use all, they don't want to waste it, because once you open the vial, you can't, it's only a certain amount of time that it's good. So you have to get your 10 people. And so they put you together. That's why it takes some time.
All right. Well, as always, we appreciate you. Stay safe, be well, and I look forward to seeing you again.
Until next time.
If you want to find out more about Dr. Huxford, there it all is up on the screen for you. We'll be back after this short break.